All right, we have an update now to our investigation into children with COVID-19. Arizona is now one of the states with the highest number of children who have died from the virus. News 4 Tucson's Coris Nylander spoke with medical experts and has more in tonight's investigation.
Since our last investigation at the beginning of December, the number of children in Arizona who have died from COVID-19 has more than doubled, and health experts are seeing a rare disease being linked to the virus. The number of Arizona children who have died from COVID-19 has jumped to 23 from 11 in December, according to data from the American Academy of Pediatrics.
Across the state, the numbers are up significantly. We all know Arizona is top in the country, maybe top in the world, always has been. And it's no mistake, of course, that pediatric numbers will follow the adult numbers because those kids are being exposed at home.
Luckily, no child deaths have been reported in Pima County. Dr. Sean Elliott is a pediatric specialist with TMC Healthcare and TMC One. He says the surge was to be expected.
So none of this is unexpected. It's horrible and it's unfortunate, but I think we're not surprised we had a second or third surge.
When it comes to children returning to in-school learning, Dr. Elliott says elementary students pose a low risk, while older children are high risk.
The challenge, of course, comes with middle school, high school, where these kids, if anything, have a higher rate of transmission than adults do.
19-year-old Juan Antonio Lizarraga and his 9-year-old sister caught COVID-19 in May and got very sick. So did their mother and grandmother. Juan urges others his age to take the virus seriously.
Even being young and healthy, it was still it took a big toll out of me. The whole almost nearly 2 months, I was just completely incapacitated. I couldn't work. I couldn't hardly move. I had a lot of fatigue, lots of symptoms that left me just in bed.
Dr. Chan Lo with Diamond Children's Medical Center says most children with COVID have done well.
They're not requiring hospital admission. We are, though, seeing multiple cases of this multi-inflammatory syndrome in children, or MIS-C, that is thought to be an autoimmune response following COVID-19 infection.
A sometimes serious condition.
They can be quite sick. They can need ICU care. They can require blood pressure support. A few have needed ventilators. In general, kids who get colds and respiratory illnesses don't go on to get these inflammatory conditions.
Dr. Lowe and Dr. Elliott hope the case numbers will start to drop as more people get vaccinated and the weather starts warming up. If you have a story you'd like us to investigate, reach out to us at investigators@kvoa.com or call our tip line at 955-4444. Investigating for you, Coris Nylander, News 4 Tucson.